For those of you who are looking at this, if you're new to the Australian Access Federation, we are Australia's trust and identity expert, and for over 16 years have established a reputation for leadership and innovation in a global network of over 80 federations. Established in 2009, we are a core part of the Australian e-research infrastructure landscape. We are the trust and identity capability for national research infrastructure. We enable trusted, safe, and secure exchange of information between education and research institutions, both domestically and internationally, through verifiable and secure ID management. We are also the national consortium lead for ORCID in Australia for the provision of persistent identifiers for research and scholars. Now, as mentioned previously, AAF leads the Australian ORCID Consortium. As consortium lead, we have roles and responsibilities such as ensuring alignment with ORCID strategy, providing administrative and technical support, developing resources, and maintaining communication with our members, ensuring that we're engaging with them and the wider Australian research sector, like these webinars today. Now, the Australian ORCID Consortium was established in 2016, and at that point, we had 40 members. To date, we have 44 members who are part of the Australian ORCID Consortium, and you can see a breakdown in the slide. So we've got, obviously, our funders, the Australian Research Council and the National Health and Medical Research Council. Then we also have research organizations like CSIRO, the Australian Research Data Commons, the Australian Nuclear Science Technology Organisation. Then Queensland Health is the only government organisation at this stage that is part of the consortium. And we also have 38 universities from within Australia who are also part of the consortium. And so, some of the benefits of belonging to the Australian ORCID Consortium is that it lowers the barrier to entry, which means it is a lot more accessible in terms of membership fees. Now, there are different access level and types in terms of membership. So if organizations join the consortium at the premium level, they are offered membership at a heavily reduced discount of over 50%. We've calculated that around $5.9 million was saved in membership costs alone since 2016 to 2025. Another benefit of being part of the consortium means members are part of a like-minded community. And of course, there is the in-country support from AEF to help you with your integrations and understanding ORCID. And so now I shall move over and pass it on to Lee from the Australian Research Council, who will be presenting. Lee, over to you.
Thanks, Melroy. Just checking you sharing the slides.
Yes, I am.
That's all right, wait till they load.
Oh.
So we'll just wait for the tech and Melroy to get that up. There we go. Good morning. As Melroy mentioned, my name's Lee Harris. I know. Is he? Oh, wait a sec. They have any Melroy?
Yep. Just bear with me one moment.
That's right.
Yeah, there we go. Sorry.
That's all right. So it's not just government people who can't operate Teams and slideshows. That's all right. We're used to it. We're used to it. Yeah, look, as Melroy mentioned, my name's Lee Harris, and I'm the Director of Evaluation and Impact Policy at the ARC. I'm going to talk today about persistent identifiers, or PIDs, as we call them, why we value them, and how they connect with policy at the ARC. Let's go to the next slide, please, Melroy. So PIDs can identify and connect the elements within the ecosystem, the research ecosystem that is. They'll be people, organisations, projects, instruments, research inputs, outputs, and more, but in a machine-readable way. So Australia's adoption of ORCID for research publications across the research sector has been extremely successful. We've been great at adopting ORCIDs, but have yet to gain the full value of this through connecting other elements such as grants, equipment, organisations, data, and diverse output types. The National PID Strategy aims to build on the success of ORCID adoption in Australia. It was developed by key stakeholders and led by the Australian Research Data Commons and a senior task force. It was convened in 2023 to develop a national PID strategy founded on collaborative action to drive national shared benefit. Let's go to the next slide. So one of the helpful aspects of the national PID strategy was the identification of 5 priority PIDs. There are many PIDs that exist with varying usability and application. By collectively working towards implementation of these priority PIDs, we can increase the return on investment into PIDs in Australia. So the 5 priority PIDs, for those who aren't aware, are ORCID, for identifying researchers and contributors to research; RAWS, for identifying research organisations and organisations that are part of the research ecosystem, such as funders or research infrastructure providers; DOIs, for identifying research grants, data, publications, instruments and other types of research outputs in scope for the DOI service provider; RAIDs, for identifying research projects and activities; and IGSNs, for identifying research physical samples. Next slide. Thanks, Murray. So the ARC accounts for roughly 7% of research funding, government research funding in Australia. So while we have influence on the sector as the only funder of basic research across all research disciplines except medical research, we're very conscious that action by funders is not enough to drive real sector change. PID uptake in Australia, and indeed globally, is a shared responsibility between funders, research institutions, publishers, and individual researchers. The National PID Strategy and Roadmap has enabled the ARC to progress with further PID integration in a way that's aligned with collective sector movement. So that means ARC is working in collaboration and non-isolation towards sector-wide and sector-led common goals. Let's go next slide, please, Murray. So there are 2 major projects currently underway at ARC that would directly benefit from PIDs. The first, that's the implementation of the NCGP policy review, and secondly, the development of the ARC's research insights capability, which has been proposed as a replacement for ERA. I'll talk about that a little bit more in some later slides. For the NCGP, there are 2 ways that PIDs can provide benefit. Firstly, there can be the analysis of historical funding information to inform new policy decisions, and also the opportunity to develop better insights and analysis from the data generated through future funded projects. And for the development of the research insight capability, PIDs will be a critical way to both reduce burden and increase the quality and availability of data on research. Let's go to the next slide, please. So the ARC is committed to 5 priority actions in relation to PIDs, which will be implemented throughout 2026 as part of the ARC's PID action plan. Firstly, through the minting of DOIs for ARC grants to enable us to track the impact of funding, allow streamlined post-award reporting, drive PID adoption, and provide the foundational data needed to undertake a national research evaluation. Secondly, we'll look to link administrating organisations with their RAW to track funding and projects across institutions and encourage further use beyond ARC schemes, improving research data quality for evaluation. Thirdly, we'll require ARC grantees to supply their ORCID during the award phase of their grant, to link individual researchers to grants, publication and projects, and allow integration of PIDs into future post-award reporting. Fourthly, we're looking to be able to write back to researchers at ORCID through the research management system. So with certified information on grant DOIs without any burden on the sector to provide this. So we'll also explore writing more information, including research outputs through post-award project reporting. And finally is the introduction of a fair data policy. So aligning with emerging international standards for research data management, the ARC will provide guidance on required metadata standards to increase the interoperability of available data for evaluation, responsible management of research data and data sets that consider the care principles for Indigenous data governance. That obviously care being collective benefit, authority to control, responsibility and ethics, but also considering sensitive data and national security. Let's go to the next slide, please, Murray. So ARC's PID action plan sits within a range of policies relating to the research data, which are outlined in ARC's research data framework, which we published in August this year. So the research data framework considers what the ARC can do to improve data about research through a range of projects and policy levers. So in addition to the PID action plan, projects include looking at working with existing data collections, such as government data collections, considering institutional research repositories as a data source, and also a review of the ARC's open access policy to help further contribute to open access publications. Let's go next slide, please, Murray. So, as I mentioned there about the research insights capability, what we've proposed so far is the development of 3 unconnected but distinct components, them being data dashboards, in-depth and bespoke reports, and a state research environment report as a bit of the flagships of publication. The intent is these to be built primarily on open data, such as PIDs, and the 3 elements of the research insights capability will come together to help provide a common understanding of the value and impact of research in Australia. Let's go to the next slide. So in terms of the research insights capability, the ARC spent the last few months consulting with the research sector. We've engaged with around 59 different entities, held 50 different consultation discussions, and received about 30 written submissions. And through this engagement, it's been wonderful to hear the views from the sector on a wide range of issues, including that there's broad support for the development of a dynamic data-driven evaluation that is built on open methodologies and data, with the caveat that ARC will need to carefully consider how to ensure the evaluation is equitable. Also, the sector is very supportive of embedding responsible research assessment principles, FAIR principles, Indigenous data sovereignty and persistent identifiers. However, we've also heard there are inconsistencies across institutions' use, the integration and maturity in these policy areas, and we know we'll need to work with the sector to develop a pathway forward to bridge these gaps. Next slide, please, Murray. So we know what we're proposing is very ambitious, and it truly is a new approach to evaluation, not just in Australia, but globally. So it's no surprise to consider that the implementation will be complex and require considerable and varied expertise. We're also critically aware of other key bodies of work, such as the strategic examination of R&D and reviews within TEXA, and we also are engaging with these processes. But we're also talking with other government funders, such as NHMRC and MRFFF, so we can keep our work aligned as much as possible. And we really appreciate the feedback we've received from the sector and help shape how we address these challenges, but also capitalise on the potential of our research insights capability. And through that, we're also considering how we might sort of work to establish some sector-driven working groups across a range of topics to help develop this new capability. So in conclusion, we think this is a really exciting time to rethink and how to redefine about how we think about the value of research. How to consider how to bring tools together such as PIDs to enable us to do so in a low burden way. And I might leave it there, Murray.
Thank you very much for that, Lee. And now I'll get Julie's presentation up and ready to go.
Great, thanks, Milroy. And just while Milroy's bringing that up, I'll introduce myself. So I'm Executive Director at NHMRC. My branch looks after the Research Foundations area, which includes the large funding programs. We manage grants across NHMRC as well as any MRFF schemes that we manage. We do evaluation and impact measurement. And I personally have a very strong passion and interest in data and data quality, so that's why I'm really pleased to be able to present to you today. Before we start, I'll just acknowledge also the traditional owners of the lands on which we're all meeting. I'm here on Ngunnawal country, and pay respects to elders past, present and emerging, as well as acknowledge any Aboriginal and Torres Strait Islander people who are attending the meeting today. Next slide, please. So persistent identifiers, we've already had a great introduction from Lee, which was really helpful. The only thing I wanted to point out in this slide is the visuals of this slide. So the benefits of persistent identifiers, they bring benefits for individual organisations, but by far and above the biggest benefits are the networks and the network data and data linkage that we can then create. So that's really the power of PIDs. So I want to talk a little bit more about that next slide, please. We've already had a great introduction to the National PID strategy, which has a really strong vision and most importantly was developed with strong consultation across the sector. And I thank you, many of you, I can see the names popping up, many of you who are involved in those consultations and workshops, and really keeping that vision in mind as we implement and go forward in this strategy. Next slide, please. So as we've already mentioned, a lot of this work has been really strong collaboration between a number of these groups on the slide. NHMRC and ARC were represented on the steering group, which was the National PID Strategy Steering Group, which was really helpful. And the collaboration for this project has been essential for us to learn from each other and also move forward in a coordinated way. So as Milroy's already mentioned, ARC, NHMRC and ARDC are co-founders of and members of the Australian ORCID Consortium, which is led by the Australian Access Federation. Next slide, please. So just in NHMRC context, so the Australian context for our work is very important. So obviously we have the Australian National PID Strategy, which we already mentioned. Our corporate plan, our current corporate plan has some specific commitments around supporting digital infrastructure and data sharing initiatives, including, and it specifically draws out persistent identifiers, so which is great. We also have a newly minted information and data strategy, which we are in the process of releasing, but which does particularly call out actions around the PID strategy, which is really great as well. And also many of you who work in the health and medical space will know that there's been a draft National Health and Medical Research Strategy out for consultation, which is in the process of being finalised, and data and advanced technology was drawn out as a key enabler for the strategy going forward. PIDs is obviously a small part of this. This is much broader than just PIDs, but PIDs would also facilitate a lot of the work that is being planned under the strategy, including measuring the impact of the strategy as we go forward. Next slide, please. So some of our sort of short-term goals or direct goals for NHMRC around PIDs is that we really want to enhance the discoverability, attribution and verification of all sorts of research inputs as well as outputs, outcomes and collaborations. We want our reports and our data sets to be easily findable, and we also want the publications, data sets, software and any other outputs from our funded grants to be easy to find as well. So very similar goals to the ARC there. Just in the next slide outlines, I think, some of the broader goals, which is probably a bit about the why do we want to do this? Why is everyone sort of working towards these goals? And really, these are some of the sort of longer term benefits we see, that we can look for ways of increasing research efficiency, productivity by decreasing administrative burden. We can look at reproducibility, provenance and attribution of research. We can better understand the value of research investments and also importantly the return on those investments. We can look at ways of tracking research engagement, translation and impact more broadly. And we can use PIDs to understand connection strengths and gaps across the system. So really, and this touches on the work that CERD is undertaking, but also what Lee was talking about, looking at engagement and other measures more broadly. So we really need to think about ways we can optimise the research and innovation ecosystem as a whole to understand it and respond to needs. So that's our broad goals. We just start with really little steps, which don't feel little steps to us. Next slide, please, Melroy. So the first thing that we are proposing for NHMRC and have started implementing is that we're now putting ORCID IDs for all chief investigators in our outcomes data set, which is published online. And that we've started doing that from the July 2025 onwards and going forwards. Interestingly, our DARM's fabulous data team gave me the stats for this yesterday, and year to date, 81.3% of our chief investigators, CIA lead investigators, have an ORCID. 71.6% of all of our CIs on that July 2025 onwards data set have an ORCID. 99.7% of our administering institutions have RAW, and 90.7% of our participating institutions also have a RAW. So this is without us actually doing anything. This is just data that's collected through Sapphire as a part of people's profile. But what we're proposing moving forward is that we are actually obliging our lead chief investigators, and we call them CIAs, to have an ORCID to hold an NHMRC grant. So people going forward from, I think it was a few months ago, we implemented that. If you get grant offers this year and you don't have an ORCID, you'll be asked to get an ORCID in order to be able to manage that grant. We're also looking at the potential to write NHMRC peer review participation information back to ORCID records. So we're actively looking at that process at the moment. We really want to do all that we can to recognise the fabulous work that our peer reviewers do and make a sort of a low administrative burden way of acknowledging their peer review contributions in their own ORCID records. As we move forward, we will require ORCID for all of our chief investigators, for all applicants, and we will start to track more outputs via ORCID, and we'll also be exploring opportunities to pull data from and write NHMRC grant data to ORCID records. So really looking forward to aligning with ARC on that as well. Next slide, please. You mentioned the very high hit rates already for RAW, which is the institutional identifier. So from now, if you want to become an administering institution for NHMRC, you will need to provide us with your RAW on application and certification process for becoming an administering institution. And all of our current administering institutions do have RAWs now, I believe. We will also, as I've mentioned, include RAWs in the outcomes data set, which will help institutions to be able to draw information, and that will become more complete as we go forward. And we will also, we're looking at updates to the funding agreement to require that the NHMRC, our own RAW identifier, is used in the acknowledgement of NHMRC funding in publications, which gives us a longer term benefit in being able to track any publications that NHMRC funding has contributed to. As we move forward, we'll be looking at encouraging broader institutional adoption. So any of our partner or participating institutions, as we call them, on grants will also be required to have a RAW. I don't think this is going to be a huge change because, as you had seen from those statistics previously, a lot of those institutions already do have those identifiers, and it's just a matter of probably just putting those in our system. So Next slide, please, Melroy. Lastly, the work that we're looking at is to do more around digital object identifiers, so to ensure that we can open up persistent access and accurate citation for publications, data sets, software and grants in research. And we're really aiming to align with global open science and data sharing standards around this. So we've got a few actions in there. We've got the our medical research endowment account, or our standard grant final reports, which are pretty consistent across all of our grant schemes. We now there's a field that says, hey, if you've got a publication or an output from this grant, can you put the DOI in this field? And that that field is intended to be put straight on NHMRC's website. So that will give much more visibility of the outcomes to grants as well. We're also looking at the future and can we assign digital identifiers very similar to ARC's planning to our grants, and as well as our data sets, so that we can make those sort of more findable and easy for other people to interact with. And we're also looking at ways we can automate digital identifier collection for research outputs from NHMRC grants, so we can make the most of it, how we can make the most of these DOIs. Finally, I thought it would be worth on the last slide just talking about what are some of the challenges that we've encountered or we anticipate encountering, and we've got some questions on this to follow. That I know over the journey from 2023, since I've been involved in this project, anyone who's sort of deeply involved in data can often see the value of persistent identifiers and can see the use cases, but sometimes it's hard to really present that case in a way that gets a lot of buy-in from lots of people across the organisation. And so I think the more of us that understand this, who can and talk about this in simple ways and some of the simple business cases that and benefits that can bring, I think it's really important and useful for us to share. And the strategy's been a great pivoting point for that. Capability gaps at all levels. I must admit, being incredibly ignorant about PIDs when I started this project, and I think one of the things that's been really helpful is to just focus on a few PIDs, at least initially, so that we can understand those well and implement them in collaboration with others. But I know I still have a lot to learn, and I look forward to some of your advice from people online and working with my colleagues on this as we go forward. The research ecosystem is incredibly complex. I've worked in the research ecosystem for such a long time. I don't really have enough knowledge to know if it's more or less complex than other systems, but it does seem to me that it is. People have multiple employers, people put grants through multiple institutions, people publish in lots of different ways, and there's lots of different outputs. So we have a lot of complexity that we're trying to uncover and unpick, which is even more important that we have consistent ways of collecting data. And I think the other thing is we all have a competing priorities and a lack of resources and time to devote for this. So often when we're talking about some of the longer term benefits, they do involve system changes and data scientists and people experts working on these things, which aren't always quick early wins, but it is important that we do try and as much as possible devote the funding and the time to people so that we can reap those benefits going forward, which again comes back to the importance of collaborating with our colleagues on these. So that is the end of my presentation. What Melroy is going to share now is we've got a few Slido questions that we would love your input on. Melroy, did you want to speak about the Slido?
Yes, I do.
It's just reloading, is it?
Yes, it's just reloading. Sorry. So for those of you who haven't used slider before, it is relatively easy. All I'm going to do is when you see the slider questions come up, you will be able to see a QR code on the top left-hand side. You can scan the QR code using your phone, or you could just type it into your browser window, that is slido.com/ the number that is there. And what will then happen is it will automatically start. Your responses will automatically start coming up on the Slido webpage, on the slide over here. Happy to let everyone know that all responses are anonymous, so we won't see who is putting in what response. So please do give us all your responses. And now I'll just share the screen so that we can all see it properly. All right, so the first question, I believe, is how are PIDs currently being used at your organization?
So we'll leave these open for a little while as we go through the slides. We'll also, I think we're happy to distribute the slides, so if you want to put input into after the presentation, very happy for you to put that in as well. And we will, there's only a few of these, and we will stop for general questions as well. So we'll just give you a little bit of time to think about the question, and it's also really helpful. I can see even the number of people that are saying I don't know is actually a really helpful question in itself. It gives answer in itself and gives us ideas on how we might think about some communication around these measures. That Melroy and Lee and I have spoken about is if there are particular things that your organisation's doing really well in the PID space, best practice examples, we'd love to hear about that, and we'd be happy to talk to you in more detail or give you opportunities to present on that at future webinars. Hope I'm not overstepping there, Melroy.
Not at all. That sounds perfectly fine, and it is exactly what we would like to do. So yes, thank you for mentioning that.
That's great.
Right.
Is that the summary up the top there, Melroy? That's really helpful.
Yes.
Is that like a keyword summary?
I believe so. That is a new thing in Slido. So it's giving you keyword summaries based on what comes out in all the word text, the open text fields. And I'm moving on to the next question. So what are your top priorities for the use of PIDs? right, top priorities for the use of PIDs. There's DO and ORCID right up there on top.
Attention to note that uptake and use is starting to come through as well.
Yeah. Useful.
All right, and so I'm going to move on to the next question, which is what benefits have you experienced from using PIDs? And just as Julie mentioned earlier, and Lee also mentioned, we will keep the Slido links open. You might find that you can't type in it. You can't go back to the previous questions right now because they're part of the slide. But we will keep all these questions open. And once this is done, I shall put the Slido link in the chat. So you should be able to access it from there and answer those questions. So yes, please keep putting in your responses. We'll close the Slido poll in a couple of days and then start looking at all the responses that we've got. Julie, I was thinking while we have participants putting in the Slido polls, there was a question that came through specifically for you. It says that in Sapphire, we are unable to see all CI's profiles, only those who are part of the admin organization. As such, how can we ensure that all CIs have an ORCID ID in Sapphire? Do we encourage through our CIA to complete like we do for the profile, etc., or will it be an alert in Sapphire for those CIs who don't have it?
That's a great implementation question, Milroy. I know the issue of visibility of other CI's profile has come up for us in a number of different ways. So we will think about that and how we can implement that. It's a good question.
Fantastic. Thank you for that. And we still got a couple of people typing their answers in. Then there is another question, and this one is around the humanities side of things. So what about all the humanities research that is not able to have a persistent identifier assigned, example, artworks, designs, etc. So that has been answered by our good friend Siobhan from the RDC in that non-traditional research outputs or outputs from the humanities and social science are an emerging area. And there are examples of DOIs in particular for those sort of research outputs. However, the question then is, what about actual impact? Will there be case studies because data cannot collect research impact? And according to both the NHMRC and the ARC, research impact is the verifiable contribution that research makes to the economy, society, environment, culture, knowledge, or health. It is the effect of research after it has been adapted for use or used to inform further research. So does any one of you like to answer this question?
I might add, and then Julie can build upon that if need be. I guess with the introduction of the amended legislation for the ARC, there's obviously now a mandated and legislative function for the ARC to evaluate the excellence, impact and depth of Australian research. Very helpfully, those terms are not defined in the legislation, and that's something we actually need to work towards. Historically, there's obviously been definitions used for ERA and EI around how we determine excellence impact, we'll need to work to see what they look like into the future. Certainly we can't measure impact in a data-driven way. That's just not feasible. It's not done globally. We need to take a qualitative and quantitative approach in how we want to consider impact, be that at the project level, at the systems level, across the whole research life cycle. So I think fundamentally, qualitative analysis and case studies have to form part of that. But I guess the big challenge for us is moving from an environment where all the data submissions were provided to our C3 universities, and that obviously encompassed a lot of those NTROs or humanities research that is not so traditionally linked with DOIs or sort of findable public data sources, is we need to work to try and change that tack and improve the findability in university institutional repositories to be able to find that research. It is a big issue for us. And I can't say it's necessarily easy to solve, but we're working towards it. Julie.
Yeah, thanks. And from our perspective, so we do qualitative impact case studies, which we can definitely drop a link to the chat in. I think there's around 60 of those which are available. So PIDS can't replace that. PIDS could help, though, us identify new impact case studies to highlight, as well as help us with the verification sometimes of what NHMRC grants are linked to those impacts. So you're correct in saying that data alone is output and input data alone is not sufficient to demonstrate impact. The other thing that we're doing at the moment is thinking about what are some of the ways that we could in a quantitative way assess impact, even pathways to impact, and we did partner on a report. I think it was released back at the beginning of this year, where we looked at the impact of dementia and diabetes grant funding, and we partnered with Elsevier on doing some work at tracking those potential impacts. So that might be something we're happy to show you that report as well. We know again that quantitative, as Lee mentioned, quantitative scale kind of assessment of impacts is really tricky. No one's really cracked that nut, I don't think, but we're happy to think about ways we can work with others going forward. Thanks, Kate.
Thank you for that, Julie and Lee. Just so you know, I have moved on to another Slido poll, which talks about any concerns that you have or you've heard others express with the use of PIDS. So there is that, but while we have our participants fill out the polls, there's another question that says research outputs from a grant can be published years after a grant. How do you cover this in your reporting?
Great question, and I think this comes back to the longer term use of PIDS. So if we have your ORCID ID and it's associated with a grant, then that gives us a better chance of actually tracking those outputs, as well as one of our actions is to require acknowledgement of our funding in those outputs and using the raw identifier, which will make those outputs much more easy to find and for us to connect at scale. So PIDS is the answer, I think, in the longer term.
Great answer, Julie. I'm going to support that through and through. The next question I have, and again, it is for you, is that I'm curious as to how the reaction from MRIs have been. Are they collaborating on expanding PID adoption with the NHMRC? This is a question that's come through the chat. So, being asked if the MRIs are, as in what's the reaction from MRIs, and if they're collaborating on expanding PID adoption with NHMRC.
So I think for us, it's very early days on the implementation. So what I can say is that we have been presenting on PIDs to our research committee, which is well represented with leaders from MRIs and as is council, and they've been very supportive of us, our changes and what we're proposing. So I guess how it plays out in the ground in the institutions is definitely something that you can help us with. So I'd love to hear, if there are any, as some of these slides like the previous one and this Slido question, if there are any concerns that are coming through from your institutions, I'd really love to hear them so we can think about if there's anything we can do either in our messaging or our FAQs or in our implementation that can help with this.
Fantastic. Thank you very much for that, Julie. And I think these are all the questions we have on Slido. So what I'm going to do is I will stop the recording. So if anybody wants to ask us questions, they can do so.